We're one of the largest hepatology programs in this country and perhaps in the world, with a total of 14 full-time faculty with very diverse areas of expertise. The University of Michigan provides very strong research environment as well as resources to support us. In addition to general hepatology clinic, we have multidisciplinary clinics for liver transplantation, for liver tumor, as well as for Wilson disease. In addition to innovative care, we also need to be innovative in research. We certainly are expanding our research programs, both in viral hepatitis, as well as in fatty liver disease, cirrhosis care, liver cancer, as well as liver transplantation.
Liver transplantation as a clinical service for patients with liver failure really became mainstream about 30 years ago, and we were one of the first 10 programs in the country. We started in 1986. We recently just completed our 2000th liver transplant here, and we've been consistently able to maintain very high outcomes and success rates. We really do integrate the research into our clinical care. So for example, in our clinics, I'd say probably 1 in 4 patients enrolls in some form of a clinical trial. And that really strengthens our ability to provide novel care for patients. When you know that there's a treatment out there and you can get access to it and treat your own patient, it's really extremely gratifying and pleasing. And I think that's the thing that I enjoy the most about what I do.
Clinically, we provide care to our patients both at the university hospital as well as the VA Medical Center, which is just across the road.
The Ann Arbor VA is fully run by the University of Michigan faculty. Because of our wide reach, we have over time realized that our patients are traveling a long distance to come to see us. And we were very lucky when the VA National Office put out a call for a program called Scan Echo. What we do is essentially a multi-site video conferencing between primary care providers and the specialists. This allows tremendous amount of convenience for the patients because they get to be cared close to home. We teach primary care providers how to better care for their patients with liver disease, and this is something that can be a roadmap for the future of us delivering care to remote and sites, because as we know, subspecialty care and access to subspecialty care is often limited for patients who don't live near academic centers.
A number of years ago, we started one of the country's first multidisciplinary liver tumor programs. So patients come and they get seen by any specialist that's needed, one-stop shopping. We really spent a lot of time focusing on improving the quality of care we deliver and getting patients and their caregivers involved. So we created a patient toolkit which helps them learn about how to manage their own disease. Some of my area of research has been focused on patient and physician decision making, particularly about organ quality. So it turns out that of all the limited organs that are available, they're not all the same quality, and each time an organ offer comes in, we have to decide whether to take that one or wait for something better to come along. I've been on faculty here for about 5 years, but I was actually a fellow here before that, and I really think that this is one of the best places to do training because of the breadth of expertise.
We have a big GI fellowship program which takes in about 7 fellows a year. Because of the huge hepatology faculty, our fellows are exposed to faculty with diverse areas of interest and expertise and get outstanding training in the management of the entire spectrum of liver disease.
One of the things that drew me here as a fellow to accept the position was the fact that it's such a big hepatology division. It's a large gastroenterology division, but the hepatology, the liver training is really broad and deep as well. Research-wise, obviously University of Michigan is a research powerhouse and the GI division is no exception. Within the liver division, again, what drew me here was the fact that they really seemed to be able to provide me with exactly the kind of research training and mentorship that I was going to need to succeed. My mentors are continually pointing out opportunities for me that I wouldn't have otherwise seen. They themselves have walked this career path that I want to walk. This is where, as a fellow, this division really excels. They excel in clinical care, they excel in research as well, but as a fellow, the mentorship aspect really, I think, has taken me to the next level of my career.
We want to be able to be leaders in research, to generate new knowledge that will help patients with liver diseases. And we certainly want to provide the best possible care to our patients, cutting-edge care, be innovative with our care. And we also want to be able to train the best fellows for the next generation.